Hello, my friends and health warriors. Welcome to our new series, Expert Answers to Frequently Asked Questions about Healthy Eating. My name is Nikolai Ninev. I am a pharmacist and a certified expert in healthy eating and dietary supplements. Today we will delve into some of the most commonly asked questions in the world of healthy eating. We are here to provide you with reliable and scientifically backed information straight from the experts. In this series, we will address the questions that our patients and viewers, like you, have asked us. Your health and well-being are our top priorities, so if you have any questions or topics that you're curious about, please don't hesitate to write them in the comments. So, let's get started. Osteoporosis at 53, should you opt for hormone replacement therapy? Considering that hormone replacement therapy increases your risk of breast cancer and that its beneficial effects on your bones stop the moment you stop treatment, you may prefer the safer alternatives offered by natural remedies. A recent study in America showed that 83% of women who used natural progesterone creams had their menopausal symptoms significantly reduced or eliminated. As osteoporosis is linked to hormone imbalance, natural progesterone is likely to be more effective than estrogen replacement therapy. Other studies have shown that excellent results in relieving menopausal symptoms are achieved using extracts of soy and red clover, which contain the natural estrogen-like substances called isoflavones. Isoflavones, a type of phytoestrogen, stimulate bone formation and prevent the breakdown of bone tissue. Iperflavone, a derivative of isoflavones, has been shown to increase bone density, especially when taken in combination with vitamin D3, vitamin K2, and calcium. For best results, take this combination daily along with a dietary supplement containing a multivitamin and minerals. If you decide to start hormone replacement therapy, you should first have your estrogen and progesterone levels tested to see if you really need it. There are several ways to test the levels of estrogen and progesterone in the body. One is a blood test, which measures the levels of estrogen and progesterone in the blood. Another is a 24-hour urine sample, which can measure the levels of estrogen and progesterone metabolites in the urine. The levels of estrogen and progesterone in the body can also be measured using a saliva test. This method is convenient for the patient, as the saliva is collected in a special container and sent for analysis. Natural progesterone, which is identical to that produced by the body, is given as a transdermal cream and is considered to be much safer and potentially more effective than hormone replacement therapy with estrogen. However, this cream is only available on prescription, so a doctor should be consulted to determine the exact dose and treatment. Thank you for watching our video. We hope the information we shared today has been helpful and interesting to you. If you think this video could be beneficial to your family, friends, or someone you know, please share it. Don't forget to like the video and subscribe to our channel to not miss future episodes of Expert Answers to Frequently Asked Questions about Healthy Eating. Stay healthy and see you in our next video.